So it does make a difference who you vote for, and there's more than one issue to vote on, and I think that's very important.
Well, I think that the activism, the grassroots push to bring about change, to have some type of whatever the system is, I think has to literally be massive. And various people will refer to this, but believe me, once any type of national plan, whatever it might be, begins to filter through Congress, that grassroots movement is going to have to overcome hundreds of millions of mass advertising to beat it down, especially from the insurance companies. We've seen this insurance companies and pharmaceutical companies both. We've seen it over and over, and it will happen. So it needs to be a very sustained, hard-driving mass movement to bring about change. One other thought I had is I want to honor all the docs and nurses and a wide variety of healthcare providers out there who actually do give a lot of free care and try to patch things together, make the system work. And I've been working on a free health clinic up in Wolf Lake for folks in Noble and Whitley County. I've talked with some docs from Noble and Whitley County, and a couple of them said, "Hey, I give free care all the time in the office." And I was just reminded by those conversations to keep in mind that many physicians give all kinds of breaks, and nurses and various clinics give all kinds of breaks to patients. In fact, it's so bizarre because there are laws in place that tell the office structure of medical docs in our current system that we can take you to court if you get, for instance, if you charge this much for somebody on Medicare. If you say to somebody else that comes in and says, "I have no job, I'm 64, I'm not on Medicare," or "I'm 60 or I'm 58," if you give them a financial break, that the feds can take you into court for giving economic break, cost break to individuals who are not on that particular federal program. That was pointed out to us at various times all the way. Very much of a threat, like, don't give away any free care. That's terrible.
Well, you're talking about the free clinics, and I don't qualify for Medicare because I stayed home and raised my children. So I don't have enough work hours. My husband has a job that doesn't have insurance. There's only about 5 people in the company. So even if they pass some of these new laws that they say, if there's 55 people in the company you have to provide, it's still not going to help us. And I was turned down by 3 separate clinics that said, "Boy, you need health care, you need help, but you can't have it because you're too sick. We don't have the resources to help." We went to the Ask Clinic, and they've helped us get into rehab. They've helped us with medication. They've helped us with just encouragement. But there's still a long ways away from seeing a doctor, because a doctor won't see me.
Wasn't it the case that you were quite well a few months ago?
Yeah, 1 year ago, I was walking. My daughter had to have her gallbladder out, and she was, 5 months pregnant at the time. So I went down to North Carolina and spent the month down there and had a really great month. On Thursday, I was fine. On Friday, it was a rainy, miserable day, and I have arthritis in my knee, and I was like, it's a bad day. Anybody who has arthritis knows it's raining, you're going to have a bad day. By Saturday, I was using crutches in the morning to get around. By night, in order to try to get to the bathroom, I had to crawl. By Sunday morning, I couldn't even crawl. We went to the emergency room down there, and they said it was probably a kidney stone because I was unable to urinate at that point, and they pulled off 2,800 cc's of urine. A person is not supposed to be able to hold that much urine. They said, "We've pulled it off, you're going to be fine," and they sent me home. We managed to get back in the house, laid down, and my daughter said, "You've really got to get up and go to the bathroom because we're not going to have to run in the middle of the night back to the emergency room." I tried to stand up. I fell flat on my face, and I've not walked since. We were fortunate that the hospital that she knew where was at wrote off a 2-month hospital stay. They wrote off 2 emergency room visits. They wrote off the week that we spent in intensive care as the paralysis went up and finally stopped just below my chest. And the paralysis also was from my elbows down into my hands. I've remained having normal feeling in my upper arms and my shoulders. But then after that, they put us into a private room, and we were there for almost a month. And then they had a very good rehab program, and they put me down in rehab to get me strong enough to send me home. I saw people down there that actually had severed spinal cords up walking again because they had insurance and could stay at the hospital and stay in the program. Because we didn't have insurance, couldn't qualify for any programs, we were just brought well enough to send home. When they tried to transfer us to a hospital here in Indiana, they all said no insurance, no luck. Lutheran says they can help. They will help if you have good insurance. If you don't have insurance, don't call us. We'll call you. It's been a year now. We still haven't heard from Lutheran on being able to give us any help. So it's not just, go to a clinic because all the clinics are saying, you're way beyond our ability to help. So, if we would have had insurance, we maybe, at this point, there's a possibility we could be back up and walking. And now everybody goes, well, you don't have a specific diagnosis? They didn't come up with anything? I've got lesions on my spine. I can't walk. What more do you need to know? I can't roll myself over in bed. I can't even set myself up.
Thank you very much. The first question you're asked when you go to a doctor's office or the hospital, first question, not how are you, what's wrong with you, how can we help you, who's your doctor. First question, let me see your insurance card.
Every Democratic candidate, other than Dennis Kucinich, wants to mollify and pacify and keep the insurance companies in it, okay? This is, in my opinion, we may have to compromise. Not now. Don't compromise now, because one of the candidates will hear us and move a little bit. You have to go way out in order to get any movement. That they're even talking about universal health coverage. They're talking about tax incentives, tax credits. This is not a tax problem. This is a health insurance problem. If every other country, that industrialized country in the world, has figured it out, we're stupid. We can't figure it out. I don't think to compromise yet. We may have to compromise this next time around, but if we keep pushing, we don't want our tax dollars. I don't want my tax dollars going to Anthem. I'm very disappointed with Hillary Clinton, and I'm going to tell you, as a woman, I would have loved to be able to vote for her, and I already wrote her a nasty letter. Sicko is coming out on DVD, and I am buying several copies, and we are going to show it for free. We have tons of information, and we have tons of friends. We got some mighty strong enemies, but we have tons of friends. If you think that I am optimistic, because you are here, and you have friends, and you have families.
Well, I don't really know what to say. I'm not a politician, and I don't want to be. That's not in my outlook. But I will say that I've worked all my life. I started working when I was 15. My wife started working when she was about 13. Government's never been timid about taking our money. But when I crushed my hand, I was put on disability. They ignored me. They didn't want to help me. There was nothing they could do for me. That was not their problem anymore. I was no longer their problem. My wife, she came down with cancer in her liver. She was not their problem anymore. They didn't care about her. And you talk about Mark Sauter and these people. Well, I called Mark Sauter's office, and he told me strictly that there was nothing they could do for me. Well, I got the phone book, and I called every politician in the phone book that was in the phone book. I called Senator Lugar and Senator Pence. Well, Senator Pence wrote Mark Sauter a nasty letter, from what I understand, and got him to do something. They did help her. She got Social Security, but the meager amount of Social Security she gets, because she does not still not receive the health care, the medical part, which I was trying to get. She's still not receiving that, so we're paying a humongous bill for COBRA insurance, which after the first of the year, we're not even going to be entitled to get. And even if we could, the premiums would be, I think our deductible is like $5,000. We have to meet a $5,000 deductible, which we'll be paying them about $1,200, $1,300 a month. So we'd be paying out almost $14,000, $15,000 before we can get any help from the insurance.
We don't have that left.
And we don't have it left in our savings. We spent everything we've had. Like I said, we had to sign a paper stating that Lutheran Hospital could take our home if we cannot keep up the payments on her chemotherapy treatments. And, you know, you made a statement that with your daughter that, you know, the drug was a choice. Well, this is not a choice for me. This is her life. This is her life I'm dealing with. We've been married for 31 years as of the 22nd of this month. And this is my life. You know, how do you deal with, you know, someone saying that your life isn't important? That we don't care about your life. We don't, you know, what happens to you. And, you know, you're talking about insurances and things like that. I have two boys. They have my one, he's got his wife, and my other one, and my daughter, she works. But, you know, the jobs they got anymore, they don't pay enough to pay health insurance premiums, the way they state them, the way they come out. The health insurance premiums are just ridiculous. It's absolutely, you know, I don't know how they expect this, you know, and all we hear is, well, you know, it's not our problem. That's the big statement I get. It's not our problem. Now, for the politician, Senator Lugar, I feel he stepped in and he did help me in settling the Social Security claim with my wife. I feel he was a major part in that, because he wrote letters, he done things, and he followed up the case. And I thank the man. And right now, I'll thank him publicly. And if Mark Sauter had anything to do with it, I'd like to thank him too. But, you know, at first off, he didn't want to deal with it at all. So I'm not sure if he helped or not.
If it hadn't have been for...
But hadn't it been for the intervenience of...
Mr. Pence, we wouldn't have gotten help from him.
How do you deal with seeing your family go downhill? You know, a few years ago, the politicians, all before they went out of state office, voted themselves a big raise. Well, and it come to find out, that, and this was stated on the news, the reason they gave themselves a big raise, they had children to send to college. I had children to send to college, but I couldn't send my children to college. Before I got hurt, I hadn't had a raise at my job for 5 years. My wife hadn't had a raise in her job for almost 8 years. And, but yet the taxes keep going up. Everything keeps going up. But, you know, it seems like we're getting left behind. Why is that? It's because our government no longer cares about us. Our government only cares about people with money. And that's it.
Amen.
Well, you know, I think what Dave is talking about, and I think it's becoming, this is just the kind of issue, Mr. Byers, what's happening in this room is just the kind of issue that gets people very, very, very fired up. And there have been these issues in the past. Women were not allowed to vote. They got the right to vote now. People, when I was a little girl, used to throw crap out on the streets. You know, you remember people driving down the